That's amazing. And for those new to kinesiology tape, what's happening at a physiological level? Like, how does it interact with the fascia, proprioception, pain signaling? Like, what is it doing? And when you launched it, did you ever imagine that rock tape would grow into a tool that's used globally, not just by athletes, but also people managing chronic pain like myself or rehab and neurological conditions like MS? And I know rock tape, like we talked about, it's rooted in movement as medicine. So has your understanding of pain science and the nervous system evolved through your work? I'm Selena Bongiorno, physician assistant, patient living with MS, and host of Miss Wired podcast. Thank you for joining me. Today, I'm excited to welcome Dr. Stephen Capobianco, an educator, clinician, and innovator with more than 20 years of experience in manual and movement therapy. He's the co-founder of RockTape, a company whose taping methods and recovery tools have helped countless people, including myself, manage pain, improve movement, and support recovery. Dr. Capobianco has taught globally on kinesiology taping, soft tissue taping, and functional movement. Deep passion for helping people feel and move better. Dr. Capobianco, thank you so much for joining me today.
My gosh, my pleasure. Thank you for having me.
Thank you. I have some questions for you. So let's
All
start
right,
with the
shoot.
origin story. What inspired the creation of RockTape? Was there a personal or a clinical moment that made you think, like, this needs to exist?
Yeah, it's probably a little bit of both. The story has morphed over the years. We started it, and I'll explain who I started it with, but in 2009, kind of moving into 2010, I'll start with the origin of the story. Really was crested from the 2008 Olympics, where Carrie Walsh, the U.S. beach volleyball player, had some black tape on her shoulder at the Beijing Olympics. And there was a lot of inquiry about this form of tape, which wasn't as commonly understood at that time. In fact, I recall the announcers really coming up with different theories of what this tape was, that it was a tape trying to cover a tattoo. It was some type of special Chinese tape that no one really knew about at the time, albeit it was just kinesiology tape. And at that time, it was kinesio tape, which was pretty much the only tape that was out, at least to our awareness at that time. So it really kind of sparked a lot of conversation, at least here in the Western world, of what this tape was, even though it had been around since the 70s. I was a local practitioner in Northern California. I was practicing in a town called Los Gatos, just outside of San Jose. And I was like the local taping guy. I was using tape for at least the last 5 or 10 years. And so I had a gentleman approach me through some mutual connections that was in the process of creating this new form of tape called RockTape. He presented it to me. At that time, I was actually having some challenges with the tapes that I was using to help my patients move and feel better. And so I tested it. I loved the product that he had developed. And so I called him back and I said I had a model of approach that I wanted to present to him as it relates to how to use this tape. And we banded together at that time, started it out of his garage, and we built it to what we have currently.
That's amazing. And when you launched it, did you ever imagine that rock tape would grow into a tool that's used globally, not just by athletes, but also people managing chronic pain like myself or rehab and neurological conditions like MS?
Of course not. I was hoping that I could just help the patients that I was working with a better product. I knew that I had a model of approach that I felt was more consistent with what the literature was telling us. And over the years, it just continued to mushroom and grow. And I'm just so blessed that we've been able to kind of expand it globally to help people further than just Los Gatos.
Right. No, of course. And one of RockTape's core philosophies through functional movement training is that we can influence the brain through the body. So how does that concept connect to neuroplasticity? Or in other words, what does the taping actually do to help rewire any movement patterns or shift pain perception for someone?
Yeah, you brought up functional movement training, FMT. FMT is just our education platform. It's what is my professional identity, is that I want to be able to share information to be able to have both therapists as well as the individual better understand how tools like tape and instrument assisted tools, cupping therapy, and even focal vibration, which is our latest tool that we created. I wanted them to better understand what the science is telling us and how to better use these tools to influence how we move and feel. And so, if I had to kind of put it in a nutshell, tape and any tool that we have, including our hands, of how we can influence the nervous system through touch, is just better accessing, or having a better conversation is probably a better way of putting it. Having a better conversation with your brain, giving the brain the information that it needs to be able to make better decisions. And that includes how our muscles function, how we perceive where we are in space. All of those are enhanced when we give the brain better information. And I feel that kinesiology tape and other tools that we've created are great tools to be able to expand that conversation with the brain.
That's amazing. And for those new to kinesiology tape, what's happening at a physiological level? Like, how does it interact with the fascia, proprioception, pain signaling? Like, what is it doing?
These are really good questions, by the way.
Thank you.
The Let's start off with the tape. And usually when I do, when I have conversations like this, I still have to kind of bring people's awareness. I just did a training in Las Vegas this past weekend to a group of several hundred chiropractors, and even those that have been professionally trained aren't as familiar of what the mechanics of this tape are, and then how that influences all the things that you just referenced. And so let's start off with what this tape is. And my assumption is that people can see this, but I also will
Yes.
say it so you can verbally kind of pay attention to what I'm trying to communicate, is that this tape, applied to the body, works in a unique way because of its mechanical nature. And so if I tear the paper backing off of it, then you're exposed to what this tape can actually do, is that it stretches. And I can only speak to RockTape. There are other forms of elastic therapeutic tape out there, but they are based on this idea that the elastic quality, once applied to the skin, can have certain influences. So our tape, the RockTape, stretches in the vertical direction and does not stretch in the horizontal. So it's rigid one way, it's flexible in the other way, and it stretches to about 180% of its original length. Once you apply this to the skin, think about it of like any elastic band. Once applied to the skin, it will recoil. And when it recoils, it creates two mechanical effects to the to the body, to the system. It creates a biomechanical lifting effect. I call it tenting. It literally lifts the skin up and away from the underlying tissues. That includes fascia, other forms of connective tissue, nerves, muscles, tendons, ligaments, etc. It creates space between layers of tissue. That's one. But the one that we're learning about more so is the what I would say lateral shear or stretch to the skin in the parallel plane, meaning we can lift the skin in the vertical plane, but we can actually stretch the skin because of the shear effects of the tape when it's recoiling back to the center. That has been shown to actually influence a lot of things, including mechanoreceptors. These are receptors that communicate to the brain. As I just suggested at the beginning, it's so important to have a better conversation with the brain so then the brain can make better decisions. So this lateral or side to side shearing, stretching of the skin has been shown to stimulate certain receptors in the skin, underlying connective tissue, including superficial and deep fascia, to be able to provide that stimulus, that information to the brain. So mechanically, it's the elastic quality of the tape that has this lifting and shearing effect to the skin. Neurologically, it's actually stimulating certain receptors, touch receptors, that provide this information of this body part, whatever area that we're influencing with the tape or tool. It's providing more information. Where is this body part in space? It's giving the brain more information. Specifically, when I'm talking to communities like yours with MS, with the demyelination, we know that information from the body part could be fuzzy, could be,
Right.
the Wi-Fi system is not as connected, just like we just discussed before we
Yeah.
jumped online here, is that if the Wi-Fi connection is faulty, the brain isn't getting the information that it needs, so it starts to make assumptions. And some of those assumptions are based on good information, some are not. And that usually parlays into, the things that most MS, folks are feeling is muscle tension, pain, and the combination of which is really a reflection of how the brain doesn't necessarily know where a body part is in space.
Right. And I was reading your other paper that you wrote with MS, and it was so interesting how people can kind of feel where they are better with the tape on. And I know when my chiropractor first taped me, I was a little hesitant because I always get like a rash or an irritation on the skin.
Hmm.
Your tape did not do that. So I had it on for
Yeah.
2, 3 days, and it was amazing. I was amazed. I didn't have any redness like I've had in the past. So I was impressed.
I think it's a good opportunity for us to discuss, like, best practices, right? So like
Yeah.
I'm not suggesting that this tape is indicated for all individuals. And so what I always tell people is like ask the right question first and foremost. Have you ever had a skin reaction to any type of adhesive, including a simple wound bandage like a Band-Aid?
Right.
The adhesive that we use, and maybe this is a good opportunity to talk about, is that, it's cotton and nylon. Again, most kinesiology tape or elastic therapeutic tape is a combination of cotton and nylon. Some use different synthetic fibers, but the majority of them are cotton just because of the breathability and ability to withstand moisture or water. Because, like you said, the intent is to have this tape on your body for minimally 3 days, up to 7 days, in fact. And so we want something that's breathable, that has the ability to expand and retract like the skin does. And so that's the nature of the fibers. But the adhesive that we use is an acrylic-based adhesive, and that adhesive is similar to most of the wound bandages that you will find in the market because the community of kinesiology tape, wanted to find an adhesive that was most consistent or compliant to the skin. And so, but that doesn't mean that everyone tolerates it.
Right.
So, what I usually say is if you are responsive or you respond negatively to any type of adhesive, this might not be the right tape for you. I always recommend a test patch where
I
you
was just
cut a
going to ask you
small,
that.
yeah, just test your skin. You put it on an area that is inconspicuous. I usually put it on the inside of the forearm, and I just test within a few minutes. If your skin is not going to tolerate the adhesive, you'll know. And you'll
Okay.
know by the tape becomes itchy, it gets red around the edges, the skin starts to lift, meaning that you start to get some inflammation in the area. That
Right.
would indicate that you're probably not a good candidate. Most people tolerate it just fine. Now, I just tell people once you have the tape on, if you experience any type of sensitivity, itchiness, redness around the edges, just remove it. And we explain
Right.
how to remove it safely. And to your point, maybe previously it wasn't necessarily your skin's response to the application. It might have been just a removal process. So when you remove it sometimes incorrectly, like my mother used to tell me, take the Band-Aid
Take a
off by
best.
gripping it and rip it.
Right.
We don't recommend that removal process with this type of tape because of how it adheres to the skin. So if you put it on and take it off correctly, the likelihood of having skin reactions is pretty low.
And how do you recommend someone to take it off?
Yeah, so good question. So I generally say, and when we're putting it on the body, taking it off the body is to remove it parallel to the skin. So when you're removing it
Okay.
from the body, you want to hold the skin adjacent to the tape edge, and then you remove it by just folding it parallel to the skin versus perpendicular. So if it's on the skin like this, and you're pulling it off perpendicular, what generally happens is that you lift the skin more aggressively away from the body, creating shear damage to the skin. So that is probably the best recommendation. Fold it
Okay.
parallel to the skin, hold the skin adjacent to it, and slowly move it in the direction of the hair growth. Just makes it more comfortable.
Okay. Cool. And then I know you've expanded well beyond tape now. You've got rock pods, rock blades, the vibe tools. What are you hoping to improve with these tools and how do they complement the tape, both in movement and recovery? I know personally I've been using the rock pod vibe. I
Hmm.
love it. So I was wondering, like, that's going on like vibration technology, right, for pain relief. And just
Yeah.
if you could talk a little about that.
Yeah, sure. So over the years, when Greg, and I should bring up his name, Greg Van Andries was the co-founder of the brand RockTape, and he's really the mastermind of developing the tape. He was an expert in textiles. He had plenty of experience working with different manufacturers to come up with what he did when it came to RockTape, and I give him full credit for just being the brilliant mind that he is. And so when we were kind of expanding our portfolio, saying what else could we create to be able to help people move and feel better, is we started to think about instruments, other tools that we could use to be able to influence the nervous system outside of our hands. And that included instrument assisted tools. Those are kind of the soft tissue, what people call scraping tools, the stainless steel tools that you could use to be able to manipulate soft tissue. We started getting into cupping therapy, and the cups that we initially started off with were our version of cupping therapy. And cupping therapy has been around for thousands of years, as most people know. We wanted to create a kind of a new and novel way, an efficient way of applying cups to the body to create negative pressure, to maximize, maybe just adding to what you just said. How does it complement kinesiology tape that creates a little micro space acquisition between the skin and underlying tissue? A cup applied to the area of the body can maximize the amount of space because it creates a significant amount of negative pressure or decompression. And so, what we wanted to solve for is that we didn't want to have the use of fire, which is a form of cupping that creates the negative pressure. So you put a flame into a glass bulb, and then you remove it and apply it to the body, and that creates negative pressure. The second way to create negative pressure is to have a pump. So you have a kind of a tube attached to these cups, and you create the pump or the negative pressure through the pump mechanism. So we were looking for kind of more unique and efficient ways of doing so. So we came up with this cup, which is called the Rock Pod. Everything that we create is rock something, and just take it for
It's
what
a
it's worth.
solid name.
Thanks. So the rock pod has a plunger, and the plunger allows, and I use my hand as an example, we put it over the area. We're trying to influence the space between the skin and underlying tissue. So you literally plunge the cup, and then it basically recoils, and that creates the suction of the cup. We have different sizes of these cups for different body parts, and they're made out of medical silicone, which allows them to be easily cleaned between patients or clients. And then they also are safe, meaning that we apply the cup to the area, and then it doesn't matter if these fall off, and they're not going to break. They're just very easy to keep up with, and they last for a long time. So these are the cups that we initially came up with. And yes, I'm adding to the level of conversation to the brain. Tape provides a certain amount of stimulus to the skin, talking to the brain. Cups might add a different set of stimuli because of the amount of mechanical effects that it has. So then I was in a place where I really wanted to take advantage of vibration, and there's lots of evidence. And if we're speaking to the MS community, my gosh, there's so much evidence as it relates to whole body vibration, like standing on a vibration platform, which exists currently. They're usually we're kind of in the clinical realm or the sports performance realm, but now they're becoming so cost effective that you can get whole body vibration units at home. And you can purchase them, gosh, on Amazon if you wanted to. But the reason I'm stressing this is that whole body vibration has really presented us clinically with a lot of research that indicate that vibration at different frequencies, from low frequency to high frequency, can really have significant benefits to those that are looking for more information of where their body's in space. So I didn't want to get into whole body vibration. These are significant, they're large tools that I didn't want to bring into my practice. So I wanted to look at how do we provide focal vibration using smaller tools like a vibrating cup. So the one that I shared with you is our next evolution of rock pods or cupping therapy is a silicone bell that's applied to the body. I'm going to get myself in the screen. And then we applied the vibration head. So the vibration head is applied to the cup, and this head vibrates at three different frequencies. So there's 75 hertz, 100 hertz, and 125 hertz. And this allows us to take advantage of the suction along with the vibration to be able to provide an amplified conversation to the brain. And we can change that conversation now with the different levels of or different frequencies of vibration. What we're learning is, and I'll try to simplify this as much as possible, that lower frequencies, what they call the flutter range, that's typically like 60 hertz and below. So let's say 20, 30, 40, and 50 hertz is what we've been experimenting with. That flutter range has been shown to be very effective helping to decrease tone in tissue. So like if you have a spastic muscle that you're having difficulty managing, using this type of focal vibration at those frequencies has been shown to be very effective at decreasing tone. And the assumption is that that frequency speaks to a specific part in the nervous system that helps the brain better understand where it is in space, and then it helps to decrease the threat associated with that area, which has been shown to decrease the muscle spasticity, tone, and reflexive types of responses. So that's really kind of where we've expanded to. We moved into using different tools, taking advantage of frequency therapy to be able to influence movement as well as pain.
It's really cool. So, question for you. Whenever I use it, I always combine like the bands, resistance bands, or weights, or just stretching, like for piriformis or trapezius muscle tenderness.
Yeah.
Is it more beneficial if you're moving compared to stationary? Like, would someone just with the vibration therapy, could you just wear them and lay, or is it better to be moving with it?
You could do both.
Okay.
I've been connected to, and you might even know this company and the individual associated is a device called the Pulse device.
Yes, huge fan.
It's a wearable device. And Ethan, and I from Pulse device have been communicating quite a bit. We've actually been collaborating because I'm so interested in frequency-based therapies over the last year or two
Yeah,
since I created these devices. And so what we've been doing is combining his wearable tool that does not create suction, right? So like let's say someone doesn't respond favorably to decompression or negative pressure therapy using the cups, but they do want to take advantage of vibration. I'm a huge advocate of what they've created at Pulse Device. So we've been combining Pulse Device along with tape. And that can be worn just passively. Let's say the
right,
individual at that time is having such significant spasm that they're not ready to kind of load or even move yet. So taking advantage of the vibration in a passive position, just laying down or seated, is a good starting point. But to your point, and this is consistent with what we communicate within the FMT model, our education model, is that information is along a spectrum. So we can get information in a passive position, but we can really amplify that information to the brain while moving. So moving just provides the brain, that proprioceptive information as well. So
right.
we're providing a touch stimulus to a part of the brain using the vibration tape or tool. And now we're taking advantage of proprioception, another map system in the brain that we could take advantage of. So combining movement and these therapies really is like the secret sauce of getting the maximum amount of information to the brain that the brain needs to be able to make better decisions.
Yeah, you laughed when you said you had a collaboration with him. I think just yesterday I had the pulse device on my knee and the rock pods on my neck.
Right. And so this is I call it the kind of like the toolkit. I have my own
Right,
toolkit. I've experienced chronic pain for probably the majority of my adult life. I've paid the price of collision sports when I played youth and college athletics. And so I'm trying to find tools even for myself that are accessible, cost effective,
right,
safe, obviously, and then science informed. And so I have my own toolkit. So days that I'm really inflamed because I might have spilled over from, doing a certain activity, I have my toolkit, and that includes vibration therapy, tape, soft tissue therapy tools that I, I've started to hone my own program that I could just listen to my body and know today is going to be a passive kind of sensory day where I'm going to be communicating to my brain and helping decrease threat, which is really what we're trying to do with these tools is
right.
provide the brain the information that it needs so then the brain feels more safe. And so when the brain is in the state of safety, you actually just move and feel better. When your brain is under threat, thinking, I don't know where my foot is in space, I'm going to protect it any way I can. So I'm going to tighten the muscles around my foot and ankle. And that kind of leads
Right.
to the issues that people have when it comes to balance and ambulation or walking. So I have my toolkit for when I'm really inflamed and not feeling well. And then I have my toolkit when I'm trying to optimize my ability to move. And so I use these while I'm training. So I have the cups on my shoulder while I'm doing my
Yeah.
Indian club, exercise, for example. I'm doing all these things to be able to kind of keep that conversation going with my brain.
Right. And I read you used to do Iron Man, right?
Used to is a great way of putting it. Yes, I was treating a lot of Ironman, triathletes in general, from
Right.
short distance to long distance, and they would be coming in saying, "This is what I experience at mile 105 on the bike," and I'm like, I don't know what that means. Like
Yeah.
I didn't know how to perceive what they were experiencing. So I said to myself, I have to experience it. And so I started the process of training just so I could better connect to my patients. And I started to love the sport. And I'm not, if you looked at me, not on the screen, but if you looked at me, I'm not the typical triathlete. I'm a 230-pound hockey player. So what am I doing on a bike for
Right.
112 miles? But I chose to do it and I did it. And this is something that I want to share with everyone that's listening to this, regardless if it's the diagnosis of MS to chronic pain to amputation. Everyone can accomplish their goals. It just comes down to incrementally adding the stimulus, just going back to what we've been talking about. So then the body adapts. And the body is so freaking amazing that it can adapt to anything, regardless of the diagnosis.
Yeah, that's amazing. I'm an endurance cyclist, so I get it because
Mm.
people are like, "Oh yeah, my piriformis starts to hurt around like mile 70," and they're like, "What?" Like
Say
they
what?
don't get that, but you get it. The other day, actually, I was on the Peloton and I was having spasms, so I put the Rock Pod Vibe on while I was on the Peloton. So it
Hmm.
really helped a lot. What are some
Great.
of the biggest misconceptions about kinesiology tape? And for people with MS or chronic pain, how can they get started? Are there any go to tips or starting points? I know you told me in the past X marks the spot, which was helpful. So to
Yeah.
find the pain.
Yeah. So I guess the misconceptions that I continually hear, and this is just based off of old models of thinking that weren't based, or at least currently aren't based on what the science is indicating, is that this type of tape can either facilitate or inhibit a muscle. Now, I've seen that happen. I've seen improvements in muscle facilitation using a strip of tape. I've seen inhibition, like let's say we're talking about the spasticity. I've seen in real time the decrease in tone of a tissue. That being said, there's no real protocol and there's not a consistent turn on or turn off like a light switch effect. What has been shown to be supported through the literature is that the stimulus using tape, tools, our hands, movement, like you said, resistance, that over time will provide the brain the information that it needs to be able to make the appropriate decision according to what the task is. So I don't believe you can turn on and turn off a muscle locally by just taping it in a specific direction. So that's the misconception that I want to remove from this conversation. Secondly, it's not a magic elixir. And if we're speaking of tape in itself, some people respond really favorably. I'd say most people respond
Right.
favorably, but some do not. And so I don't want people to expect that everyone is going to respond similarly. But it's such a safe and easy thing to apply. It's worth the attempt is what I
Right.
generally tell people. We're not talking about something that like taking a pill that might have these adverse side effects. We're talking about something that we're applying to the skin. As long as you're following the best practices, the likelihood of adverse reactions is really low. So that's the first thing that I would say. As it relates to getting started, if we're talking about the end user, the individual applying it to themselves, you can tape most areas of your body on your own, except for, and I figured it out, to be honest, over the 15 years that I've been taping, or gosh, I've been taping longer than that, 15 years that I've been with RockTape, we've come up with solutions to be able to tape your own back. I could tape my own lower back, I could tape my neck,
It's
but it
impressive.
takes some, take
Right.
confident and actually proficient at doing that. I've had a lot of messed up, applications, trying that. But in most of the areas you can tape yourself, a loved one, a caregiver, a friend, let's say a cycling buddy could tape, you can tape each other. But the general rule is less is more. And what I mean by that, when you have a strip of tape, you are basically cutting the strip of tape, and they come in pre-cut strips as well that are just mostly applicable to most areas of the body. You're basically cutting a strip of tape to be able to fit the area that you're trying to influence. Let's say you're having foot drop and you want to influence the muscles, the area of the body, I should better say, that help your brain better identify where your foot and lower leg are. You're basically putting a strip of tape, one strip of tape, and I want to stress this, one strip of tape over the area that you're trying to communicate with, that you want connection with, a better Wi Fi connection, another way of putting it. So we're cutting a strip of tape that will basically cover the top of the foot onto the shin, and we're just applying it like a band-aid. And that's a great starting point. A single strip of tape over an area that you're trying to influence will suffice for the majority of people. If you don't get the outcome that you're looking for, as you just referenced, the X marks the spot is now just adding a secondary strip. So we have one strip over the foot and lower leg, a secondary strip creating the X marks the spot. What this does is that where these two strips of tape bisect, it creates a greater lifting effect, a greater mechanical effect at the area that we're trying to influence. So the two strips of tape maximize the lifting effect, maximize the amount of stretch that we discussed at the beginning of this conversation, which kind of maximizes that conversation to the brain. So if and when necessary, the X marks the spot over the target area. That could be my shoulder, that could be my piriformis, like you referred to at the back of your hip. It could be my calf. It could be any area that you're trying to maximize that conversation with. So start off with one single strip of tape over the area, just like you're, covering a wound. And then the second one would be an X marks the spot if you're needing more of a stimulus.
Very cool. And I know rock tape, like we talked about, it's rooted in movement as medicine. So has your understanding of pain science and the nervous system evolved through your work? Like, did you learn new things that you didn't realize before just through working with all of these tools?
Of course. My gosh. Where do I stop? I can have this conversation for hours is that what I used to be known for as like the movement mechanic, and I'm using that word, specifically because I was the mechanic. I was operating on X tissue, your piriformis, a gastroc, a hamstring, a rotator cuff. I was, the guy that you would go see, especially me being a larger clinician. They wanted to see me because I can go deeper. And so that was like my mantra for my first half of my career, which is amazing to think about it, that I spent 10 years of just beating on tissue. Did I not have good outcomes? Yes. I
Right.
had really good outcomes. I really built my name through being that manual therapist that really was the deeper is better approach. But over the years, the science is indicating that maybe we didn't need to do that. Maybe I could have done less and still provided a good outcome, if not a better outcome. And so the evidence now is telling us that less is more. We can actually have a pretty significant effect just by manipulating the skin. And that really kind of got me interested in tape because it's a very subtle stimulus that really influences the skin mostly. And so, what I would say, what has changed over my 23 years of practice now is that I take advantage of a subtle stimulus to be able to help someone better connect to a body part versus where in the past I would have dropped an elbow to
Right.
go into that tissue to quote unquote release it. So I'm more of a neuro based practitioner now, taking advantage of what we know about the brain, how the brain influences how we feel and how we move. And the brain can take advantage of real light touch to be able to influence where it is and how it moves.
That's really cool. And I know you touched on this a little bit, but what really sets RockTape apart from other companies? Is it more the products, the education, the mission? I know you're so big on education. I've learned so much from all your videos.
Yeah. That's an interesting question. I think what we're known for is yes, that we're science informed. I use that because sometimes saying science based or yeah, science based is that we get shackled by the science, meaning that if we don't have, numerous systematic reviews and meta-analyses that are saying that exactly what I'm telling you is the fact, which is very difficult to get done, as you know, when it comes to
Right.
humans in general, and that's just like human subjects. So science informed to me means that we're taking what the evidence is telling us and starting to apply what that knowledge is giving us. And we know that the science takes, between 7 and 15 years to get applied to, clinical protocols. We're starting to apply these using the information that we have now, so then we can see, as long as we're doing it in a safe manner and following the best practices, we're starting to see those changes right now versus waiting. Just like what I'm sharing with you as it relates to focal vibration. And then the other thing is that we just don't take ourselves so seriously. So our brand is based off of the idea that movement matters, and if we can help people move more effectively, they'll get to move in a more meaningful way, connect with their communities, and so that's really what we're based around is science informed and movement, and that's really what I still get to do when it comes to representing the brand.
That's so cool. And it seems too, I've seen a lot of stories on the Instagram. It's not just humans, right? I see
Hmm.
like a lot of horses. And are there other animals that people utilize the tape for, or mostly just the equestrian community?
No, well, I'd say the equestrian community is probably one of the most active, but I've been able to tape, elephants and
Wow.
dogs and everything in between. So, like animals, interesting enough, taking advantage of what the literature is telling us in humans, they're starting to now extrapolate and apply to animals, and animals respond. And I'm an equine and canine chiropractor as well, so I get the
Oh, cool.
opportunity of working with animals, horses in particular, using our spinal and extremity manipulation techniques, they respond like this. So what they always say is that the animal is kind of a placebo, resistant response, meaning that
That's interesting.
whatever
Right.
we're applying to the animal is an immediate response back. And when it comes to tape on even horses' hair and dogs' fur, we see immediate changes in those animals. So we know if the tool, the tape or instrument is going to be a benefit, you'll see that very quickly with these animals. So I love working with
That's so
animals with
cool.
these
Yeah, because
types of tools.
they can't fake it.
That's right. They
And
tell
I've
you
seen
exactly.
they cup too, right? I've seen like the rock pods on them too, right?
Yeah, that's kind of been an evolution that I didn't think was possible when I first started, especially creating the cups that we create. But these cups have a very wide lip to them, and that wide lip provides a very good anchor for the cup to adhere to the body. And I didn't think we would have good success attaching to horse's hair, for example. But what we found through experimentation, if you use some type of gel, a lot of folks are using ultrasound gels applied to the area. It creates a better seal, and you get the similar types of decompression, that negative pressure effect on horses' hair as well. So we're seeing some good
That's so
effects
cool.
by applying that on horses.
That's really cool. And I know from
I
a
know.
provider perspective, a medical provider, how can someone get involved with RockTape? I know there's a lot of educations and certifications and classes. If someone wanted to learn more, what could they do?
Yeah, so there's multiple ways. You can go from the YouTube way. We have a YouTube channel at RockTape that you can start to see some of the applications that we demonstrate. There's some short form content that you can kind of get kind of a simple explanation of how this tape works and how to apply it more so on humans, but there are some assets for animal interventions as well. So that would be a good starting point, is going to our website as well as YouTube, to our YouTube channel. We have an education platform, as I referred to earlier, FMT, the acronym Functional Movement Training. FMTplus.com is our education platform, and that is where we house all of our long form continuing education accredited courses on, from taping to instrument assisted techniques to cupping therapy, vibration therapy, and more. So that would be kind of a more advanced understanding of how to use these tools. And then we do private, live virtual, live in-person trainings as well, to like clinic groups where they would invite us into their clinic and they have all of their therapists in the same place, where we do live in person, which is really the best way to learn these types
Right,
of
hands on.
intervention, is to do it hands on. Correct.
Right. That's cool. And my last question, I was curious. If you could design one dream product or some breakthrough tool for people with MS or any neurological condition or chronic condition, what would it be?
I'm already moving in this direction because I know that the technology is caught up. AI is definitely going to be a great tool
Right.
to kind of amplify how we better communicate with the nervous system. Even organizations like the Pulse device, having these wearable tools now that we can more efficiently apply to whatever body part that we want. I'm starting to see that the wearable community having clothing, socks, things that we
Yeah.
have on our body, and making them into more smart garments. And so having something that doesn't require us, I might be taking the organization that I started out of business, but taking away the added step of having to apply something to the body, but doing something that we all do, most of us do, that being said, of just putting on clothing, and that clothing has the ability to receive information of the body as well as deliver sensory information back to the brain. So that's what I see the future, at least the short term future, giving us,
Right.
is taking advantage of smart garments,
Like adaptive tools. It's funny you
adaptive
say that
tools.
too. I was on the bike and someone was screaming at us for no reason, and we're in the middle of nowhere. So I went
Of
that day
course.
and I bought the AI glasses. So I always joke, like, I might die, but you can live stream it on, you can see it live streamed on my Facebook. But for a
Yeah.
safety tool, yeah, they're really good. And I get
Yes, they
great
are.
footage while we're cycling and I feel
Right.
safer and going up a bridge. It's just really cool. But you're right. So I think that is definitely the future.
Yeah, it is.
But Dr. Capobianco, thank you so much again for sharing your expertise and creating tools that truly make a difference for all of us, especially those of us navigating chronic pain and multiple sclerosis like myself. Your work continues to inspire people to move better, feel better, and trust their bodies again. So your tools have changed lives, just know that, including mine. And
Thank you.
today's conversation is just a reminder to me that the right support can completely shift how we move and feel. So, to everyone listening, I hope today's episode gives you new insight and practical ways to support your own movement and recovery. Hating for yourselves, keep moving in whatever way you can, and never underestimate the tools that help us show up stronger. As always, thank you for being here, and we'll see you on the next episode.